So when it comes to the complications of breast surgery, I tend to break these up into short-term and long-term concerns. So the short-term relates to going through a general anaesthetic, going through a surgical procedure, potential for blood loss, potential for a collection of blood around an implant called a hematoma that might necessitate a return to the operating theatre. Within the next period, post-operatively, the risk of infection is possible, and we counsel them about the preventative measures that we utilise to minimise that occurrence. That can be a disaster. The implant may need to be removed.
So I guess the complications eventually occur for everyone. 25 years down the track, you might have an implant rupture and been lucky to have gone that far. In general, 1 in 100 women per year is going to need a reoperation, 1 to 2. So by 10 years, 8 to 9 women who have out of 10 who have breast implants will still have them. By the time we get to 15 years, probably half still have their implants, but the rate of requiring reoperation at that point is getting quicker.
Part of our training in Australia when it comes to breast implant surgery is all about sterility. The products that we utilise, we know, we trust. They come along and they've been sterilised. They're all good quality products with minimal infection risk, of course. But it's something we have to counsel people about. An infection around an implant is a disaster, and often it means that the implant needs to come out. Other things that can happen in breast implant surgery, a hematoma is something, a collection of blood around an implant is possible. It can be secondary to the surgical procedure itself and bleeding soon after, but it might also be the result of any sort of wave of trauma or activity after surgery.